I'm Ben Phillips, UNAIDS Communications Director, and I am your MC for today. I would like to begin by acknowledging that the land on which we gather is the traditional and unceded territory of the Mohawk people, a place which has long served as a site of meeting and exchange amongst nations. We are grateful for this opportunity to meet on this territory and commit to the pursuit of truth, reconciliation, and allyship. I would now like to ask Dr. Adiba Kamarulzaman, the President of the International AIDS Society, to open this launch event.
Thank you, Ben, and good afternoon, everyone. Welcome to the launch of the 2022 UNAIDS Global AIDS Update at AIDS 2022, the 24th International AIDS Conference. My name is Adiba Kamarulzaman, and I'm the current president of the International AIDS Society, the organizers of this conference. I'm very pleased to be here today. Thank you, UNAIDS, for inviting us to be amongst esteemed colleagues, and want to thank the City of Montreal for hosting us. The theme of AIDS 2022 is to re-engage and follow the signs, with the aim of refocusing global attention and resources on this other global pandemic, HIV pandemic. Each year, the UNAIDS Global Update provides a snapshot of our progress in the global response to HIV. It provides key data and insights that inform HIV policies and programs and advocacy. These are the sectors the International AIDS Conference bring together, so it is especially appropriate that UNAIDS is releasing their report here today. As you will hear, the key data in this year's global updates are troubling. We cannot afford to lose more ground in the global response to HIV. One of the figures that you will hear is that 70% of new HIV infections in 2021 occurred among key populations, which illustrates that the most marginalized are also the hardest hit. We urgently need to make resources available, close research gaps, and eliminate the stigma that still pervades thinking. Most crucially, we must ensure that scientists, policymakers, and activists come together to achieve progress. It's time to re-engage and follow the science. Today's panel include representation from government, civil society, and academia from across the globe. And we hope that you take away from today's conversation that, number one, we are not on track, but number two, we certainly can be. Thank you, Ben.
Thank you so much, Dr. Adiba. I would now like to ask Winnie Byanyima, the UNAIDS Executive Director, to launch the report.
Thank you, Ben. And good afternoon, good evening, good morning to all of you. The data we are sharing today brings painful but vital news. Our report, In Danger, is what we have called it, In Danger, reveals that the response to the AIDS pandemic has been derailed by global crises, from the colliding pandemics of HIV and COVID to the war in Ukraine and the resulting global economic crisis. Progress has been stalled. Inequalities have widened and resources have shrunk. Millions of lives are at risk. Here are some of the stark findings. New HIV infections dropped by only 3.6% between 2020 and 2021. This is the smallest annual decline since 2016. So 8 years ago. The decline in new infections has stalled. In Eastern Europe and Central Asia, in Latin America, and in the Middle East and North Africa regions, 4 regions. New HIV infections have been increasing every year over multiple years, of the last few years. But now, in Asia and the Pacific, the world's most populous region, our data shows that for the first time, new infections are now rising in that region. Previously, they had been falling. So now another region, we're beginning to see declines in rather increase in new infections. In East and Southern Africa, where we have the fastest progress on reducing new infections and reducing deaths, even there we are seeing progress slowing significantly in 2021. There were 1.5 million new infections last year. This is more than 1 million above the global target. I can hear myself. I'm hearing myself. All right, thanks. It's corrected. Last year, 2021, we lost one person every minute to an AIDS-related illness. One person every minute died last year. Even though we have the medicines needed to save those lives. If these trends continue, we could see 7.7 million additional AIDS-related deaths in this decade. So the multiple global crises have undermined services. Let me tell you how. The number of people on HIV treatment grew more slowly in 2021 than it has in over the last 10 years. So fewer people coming on treatment. Of all the children living with HIV, only a half, 52%, are on life-saving medicine. There's a huge inequality between children and adults in accessing treatment. And that gap is increasing. So we have to sound the alarm. UNAIDS is sounding the alarm. But let me be clear. This is not a counsel of despair. It is a call to action. Because even amidst these crises, we see remarkable resilience in some places. This report that we are releasing today shows us how to achieve an effective response. It is by addressing inequalities head-on. What do I mean? First, inequalities in access to services. Our data show that HIV services aren't equally accessible. In some countries, it is the poor who lack access. In some, it is racial and ethnic minorities, such as in the UK, where the declines in new HIV diagnoses have been greater among white populations than among Black people. Or here in Canada, where the gap is growing between Indigenous people and other communities. In this report, you'll find an inequalities analysis that shows some countries have achieved near equal access for the rich and poor, often because of having community-based and community-led services. Second, gender inequalities. Our data show that every 2 minutes in 2021, an adolescent girl or young woman was newly infected in HIV. Think about it. Every 2 minutes, a girl was being infected by HIV, or a young woman. COVID pushed millions of girls out of school. It brought spikes in teenage pregnancies and violence against women and girls. In sub-Saharan Africa, girls and young women are now 3 times as likely to acquire HIV as same-age boys and men and young men. Effective pandemic response means addressing gender inequalities. Botswana, for example, extended universal secondary education. And Botswana found that for each additional year of schooling, there was a 12% reduction in girls' risk of acquiring HIV. So there are solutions. Economic inequalities. During COVID, debt repayments for the world's poorest countries have reached 171% of all spending on healthcare, education, and social protection combined. Debt repayments, 171% of total spending in the areas that can reduce HIV infections and deaths. Countries' capacities to respond to AIDS are being choked. Domestic funding for the HIV response in low and middle income countries has fallen for 2 consecutive years. But we can tackle inequality. We can tackle that economic inequality. In 2021, many of the most resilient AIDS responses, again, this is shown through our data, those responses where we had rapidly falling new infections and deaths, that is where we had national governments, PEPFAR, and the Global Fund working together to ensure that there was sufficient funding for the AIDS response even during the crises. So solutions are there. We can tackle these inequalities, but we must come together and invest the resources that are needed. And that happened in some countries during the crisis. Then inequalities in laws. Our data show that in 2021, our key populations data shows that gay men and other men who have sex with men have 28 times the risk of acquiring HIV compared to people of the same age and gender identity. That's how big the gap is. Closing the inequalities by removing punitive laws, promoting human rights, and expanding community-led services is working in countries like Thailand, where we see things improving. So ultimately, ending AIDS would cost much less money than not ending AIDS. Importantly, the actions needed to end AIDS are also key for overcoming other pandemics and key for protecting ourselves against the threats of future pandemics. So we hit 3 targets at once. When we fight AIDS, we also provide the way to overcome other pandemics, and we protect ourselves from future pandemics. So we can end AIDS by 2030, but the curve will not bend by itself. We have to pull it down together. Thank you. Back to you, Ben.
Thank you so much. Really
I
powerful.
recommend the report to all of you. There's a short version like this one. You can read it in 1 hour, even less.
Really powerful. Thank you. Now we have online Dr. Anthony Fauci, one of all of our heroes, and we're so honored that he's joining us today. Thank you so much for being with us, Dr. Fauci. Please share with us what most resonated with you from this report.
Well, warm greetings, everyone, and thank you so much for giving me the opportunity to be with you here today, albeit only virtually. Winnie, thank you for your remarks and for the extraordinary work of the UNAIDS team in developing the latest global AIDS report. The data in this report and the perspectives you provided are invaluable to all of us in the global HIV community as we work to truly end this pandemic. I've read it, as you said, and you can do it in less than an hour. The executive summary is wonderful. It is well written and it's data rich. To all those in the global HIV community who work so hard advocating for better access to HIV prevention services and treatment, raising your voices to break down the stigma, discrimination, and disinformation that still exists around HIV/AIDS, I salute you and I thank you. As you just heard from Winnie, the new UNAIDS report is aptly called In Danger and is a reminder that the global plague of HIV continues to rage, even as much of our attention has been diverted to other important health concerns, such as the COVID-19 pandemic, and more recently, the global spread of monkeypox. There has, without a doubt, been backsliding in the HIV response amid the COVID-19 pandemic, as Winnie has just described. Testing and hence HIV diagnoses decreased in many countries, including in my own country. Harm reduction services to people who use drugs and other vulnerable people have been widely disrupted. Reduced access to TB diagnosis and treatment resulted in an increase in TB deaths among persons with HIV in 2020 compared to 2019. What the new report calls, quote, faltering progress, unquote, means that 1.5 million people were infected with HIV last year, tragically 3 times the global target that we had hoped for. This report is a wake-up call. As the global HIV community meets at this International AIDS Conference right here in Montreal, the conference theme, re-engage and follow the science, could not be a better fit. I am sure that I speak for all my US government colleagues when I say that we remain fully committed to the kinds of engagement needed to get us on a course to reach our goal of a world where HIV infections are uncommon and HIV deaths rare. In this regard, President Biden in December launched a new national AIDS strategy and called it, quote, a plan to make sure that the latest advances in HIV prevention, diagnosis, and treatment are available to everyone, regardless of their age, race, gender, identity, sexual orientation, disability, or other factors, unquote. As most of you know, President Biden recently appointed a new global AIDS coordinator, my friend, Dr. John Nkengasong, who will be speaking shortly, and who is just the kind of experienced and visionary leader we need to lead the PEPFAR program. I'm encouraged by the president's robust budget request of $7.4 billion for the fiscal year of 2023, as we look to bolster this key program that so far has saved 21 million lives. Over the past 2.5 years, I have seen many similarities between COVID-19 and HIV that sadden me. How hard some patient groups need to fight for recognition, how stigma, misinformation, and denialism can promote illness and death, and how slowly interventions reach vulnerable populations. Collectively, all of us in the global HIV community must double down on our efforts to implement existing treatments and strategies for prevention, to strive for better ones, to reach vulnerable communities, and to renew our commitment to equity, education, and outreach, as I will bring out in my talk later on in the meeting. Today's report reminds us that we can do better. In this, the fifth decade of AIDS, top priorities of the HIV/AIDS community must be to better implement existing treatment and prevention modalities while working simultaneously to improve and optimize the next generation of interventions. The scientific accomplishments in the field of HIV research over the past decades reflect an extraordinary journey of discovery. Our challenge for the next leg of our journey is to build on these advances and deliver proven treatment and prevention interventions to everyone throughout the world who needs them. Again, thank you for so much for the chance to join you today.
Thank you so much, Dr. Fauci. Our next panelist has such an inspiring story and was such a joy to meet. And I'm really pleased that Ms. Karen Dunaway from the International Community of Women Living with HIV will share her reflections about what this report means for her. Thank you so much, Karen.
Thank you, and good afternoon, everyone. It is an honor to be at the launch of this compelling AIDS report. And as a young Latin American woman born with HIV from Honduras, I have been engaged in HIV activism for almost 18 years now, and have seen the great strides we have collectively made in the HIV response, but I have also witnessed the setbacks as well. As the eye-opening and devastating findings in these reports illustrate, the HIV response is now at a critical point. The COVID-19 pandemic and our unpreparedness for it have taken a heavy toll on the achievements of the HIV response. Young people, especially young women living with HIV, have been one of the hardest hit communities during the pandemic. And the negative impacts of the pandemic has been compounded by existing gender inequalities and social disparities. As you have seen and you have heard, now every 2 minutes, an adolescent girl and young woman is newly infected with HIV. And the pandemic made this worse, causing disruption of key HIV treatment, prevention services, disruption of sexual and reproductive health services, including maternal health care. It kept millions of girls out of school, increased confinement, and reduced girls' ability to seek help and support. I also want to highlight here that Latin America have seen an increase in annual HIV infections over the past decade, and special concerns goes to Brazil as well. These realities have made us more vulnerable to gender-based violence and other right abuses. The findings in this report and the data we have uncovered are much, much more than numbers. They're the lived reality of women living with HIV. In a recent study we conducted in ICW Latina, a young pregnant woman from Nicaragua told us that when she was diagnosed with HIV, the medical staff blamed her for having HIV, and they even asked her how many men she has been with. They told her that the baby was already HIV positive without any prior testing. And in this study made by younger women, we also documented that more than half of the young women, with the youngest being 15 years old, received a suggestion of sterilization from a healthcare worker. Young women and key population continue to confront political agendas that seek to turn the clock back on our fundamental human rights, including our right to bodily autonomy. These regressive efforts place younger women in an increasingly precarious situation when women are deprived of our core rights to say about our bodies and our right to sexual and reproductive health care. And if we continue this, we will pay the high price in terms of prevention of new infections and the progress towards all the goals in the HIV response. Younger women, us, we are mobilizing, we are reaching, we are organizing, and we are doing all we can to push back against these regressive attitudes and policies to confront the damages inflicted by the pandemic. But we cannot do it alone. As women fighting for our futures, we call all of you to step up and to ensure the HIV response urgently recognizes the danger the younger women and key population faces and has always faced, but more acutely after the pandemic. We demand that the HIV response be person-centered and gender equitable to ensure our human rights and to support the leadership and courage of decision makers. To also humanize government response through the involvement and participation of communities affected by HIV, to ensure that our response goes beyond the biomedical aspects of HIV, and to respond at the holistic well-being of people living with HIV, and also to increase public investment in HIV prevention, treatment, and care. I'll end this on take a decisive action to reverse the loss of this 57% of non-US bilateral aid in the last 10 years, and recognize the lessons reinforced by COVID-19 that the work of networks of people living with HIV is crucial to addressing these unmet needs in communities, whether they are affected by pandemics, by conflicts, by regressive political issues, or even climate change. Thank you.
Thank you, Karen. Thank you. More than numbers, such a powerful message. Oh, in this tough environment, there was such excitement and joy when the head of the Africa CDC was appointed by President Biden as the United States Global AIDS Coordinator and Special Representative for Health Diplomacy, Dr. John Nkengasong. Dr. Nkengasong, in your role, in your new role, how can this report help you as you try to galvanize action around the world?
Thank you so much for UNAIDS for inviting me to be part of this, the launch of this very important report. Let me, first of all, recognize the clarity of the report, as always. I've always enjoyed reading UNAIDS reports because they are clear in both the message and messaging. And it has always served all of us as that pointer to where the pandemic is. And I use the word purposefully, pandemic is. And when I listen to Winnie and others, two things occur to me. One is that our HIV/AIDS response and struggle. I also use the word struggle because I've been in HIV/AIDS fight since 1988. That the HIV/AIDS response and that struggle is at a crossroad. We are seeing remarkable progress in some regions. If I follow the trends carefully in new cases, some regions, Southern Eastern African countries, we're also seeing new infections stalling, and in some areas or some countries increases. So that is why I believe it is at a crossroad. Second is the alarm. The timing couldn't be more appropriate to tell us, to remind us that the HIV/AIDS pandemic is not a pandemic of yesterday. It is a pandemic of today. It is a pandemic of today. And that inspires me to think that we cannot wait to fight HIV/AIDS pandemic after COVID pandemic is over. Because one of the things that has contributed remarkably to stalling some of the gains we've made in the fight against HIV/AIDS is the COVID pandemic. It has to be a question of both pandemics. How do we fight HIV/AIDS in the context of a disruptive pandemic like COVID? The report also reminds us that this is time to go back to basics. Not only know your gaps, but close the gaps. We have to know our gaps, close our gaps. And in doing that, we have to be faithful to the ability to use science and data to know our gaps and use science and data to close the gaps. And that's why the theme of this conference itself is so timely and aligns with this report in a remarkable way. For PEPFAR, where do we go from here? I believe sitting here this afternoon and listening to the reports and reflections from across the other panelists, it inspires me to think that PEPFAR has to reimagine itself at 20 and say, how do we work more closely with UNAIDS, Global Fund, and other actors to pull down that curve that Winnie just eloquently spoke about. And in doing that, we also remember that partnerships is key. Partnership with the community. Community must lead the efforts. Partnership with the political leadership. If we have to bring back HIV to the fore, we have to think about political commitment, political will, and political boldness to make sure that HIV/AIDS is, again, not considered as a pandemic of the past. We have to reimagine that. But let me just conclude by saying three things that I look forward to working very closely with UNAIDS on. One is the issue of rights. We know that those are structural determinants that, I'll call it, as we all say in public health, wider determinants, that if we address them, then they can actually structure the way that the trajectory would look like. Issues of discrimination, stigmatization of key populations. We heard the numbers, 70% of cases occurring in key populations. And the data is pointing us to several of those. LGBTQIs, children, are critical priority populations that we must work hand in hand with UNAIDS to address. We're also in the spirit of new numbers. I heard Winnie said every 2 minutes a girl is infected. I also heard Winnie and Tony talked about 1.5 million new cases. I'll contribute to that number by saying that there are about 4,000 new cases a day, and we have to stop that. It's like a sink and a tank analogy, that until we stop that water coming down from the tap and we focus only on the floor to clean the water, we will never be able to be successful in this. So we have to turn off the tap and close the 4,000 new cases that are reported a day. So PEPFAR stands ready to work with UNAIDS in all these areas, data-driven. When the going is tough, data becomes your radar on which to point you to the right direction to go and where to allocate resources and where to bring an appropriate change. Lastly, let me just finish by saying that PEPFAR will also, Winnie, as you said, you talked about the HIV pandemic and the spillover effect of what HIV can do, or HIV investments can do. And PEPFAR will be looking forward to address elevating the platforms that PEPFAR has put out there for the past close to 20 years to supporting countries, just as we are doing now with the monkeypox outbreak, how PEPFAR has used those resources effectively in supporting the COVID response. That is what it is, about fighting pandemics transversally. Thank you.
Thank you so much, Dr. Nkengasong. Now, words like courage are often overused, but when one thinks of the Ukrainian civil society workers delivering ARVs under fire, that is courage. I'm so honored that we have Andriy Klepikov, who's Executive Director of the Alliance for Public Health, Ukraine. Andrew, we've all been so moved by your work. Tell us about what a report like this means for you.
Thank you. For the first time, UNAIDS releasing Global AIDS report with such alarming title, In Danger. And for me, coming from Ukraine, in danger means that we need to act. We need to act boldly, immediate, and with solid response. COVID-19 pandemic, economic crisis, food crisis, Russian war in Ukraine, monkeypox, all these things bringing world into the crisis. And this crisis pushed back HIV response, because with testing, with prevention, with treatment, we are in some countries slowed down, in some pushed back. In order to get on track, we need more resources. And report showed fundamental mismatch. When new HIV cases are going up, funding is going down. This is we need to take and address. And of course, looking at the global picture, we need fully funded global fund. Honestly, AIDS response for the next years will depend a lot how successful global fund replenishment will be. It will depend, would we raise $18 billion at least to save 20 million lives or not? Of course, this is very appealing to us. Even the slogan for the replenishment, fight for what counts, it really resonates with the report. And we don't have too much time. And US already made its very generous contribution, but we really need other countries to respond. We need, of course, increasing funding from PEPFAR and increased funding to UNAIDS as well. Russian war in Ukraine brought incredible challenges to my country. Over 100,000 people living with HIV actually living in the areas directly affected by the war. So many moved as internally displaced people or war refugees. Overall, we are talking about 15 million people, huge population. UN forecasts are so terrible. 9 out of 10 people will face poverty by the end of the year. GDP in Ukraine by the end of the year will drop by 30% at least. Losses for health system are so severe. So in the situation of such dramatic and huge impact on the war, actually civil society and community proved to be the backbone of HIV response. In many situations, it's not the infrastructure which saving lives, because hospitals were destroyed, roads were damaged. So it's actually people's efforts, social workers, community workers, peers, case managers, who kept contacts with the patients, allowing to distance support to continue a treatment, not to get people lost, keeping their motivation, which dropped so substantially, facing existential crisis and threats to life. And in some cases, governmental system didn't work, like for delivery of IRVs, for example, it was civil society organization who did this. Another example, opioid substitution therapy treatment. So we delivered medicines to all hospitals where government refused to go. They said, well, it's too risky for us. This is the turning point where motivation became the key driver to achieve results. And motivation of civil society is so strong. And in many cases where all others said no, civil society said yes. And for HIV and overall health response, it was a critical factor. Looking at the report, for me, actually, the shocking figures, how it's still very much driven by key populations. So 70% of all new infections linked to key populations. When we look at the risk factors, for example, this page, the biggest cycle, which illustrates the biggest risk to get infected, is for people who inject drugs. It's 35 times higher than among ordinary people. So if we know this, our data and knowledge should inform our response. So it's quite substantial changes expected getting out of this report. The big thing, and Winnie already highlighted, is human rights and gender, because we cannot support people who use drugs when they're criminalized, when they're put in prisons instead of offering treatment. So it's very critical also to know that a lot depends not on funding, but on policies. For example, in our region, Eastern Europe and Central Asia, the war we are having in Ukraine started much earlier with Russian policy criminalizing people who use drugs and other key populations, refusing to provide treatment for people who use drugs with methadone and buprenorphine. It's critical to put science and evidence over ideology and prejudice. Otherwise, we will not win this battle. It's critical to understand that it's 100% true that we cannot win HIV battle without addressing human rights. And it's not happening by default. With the human rights, it requires a lot of efforts, a lot of resilience and readiness to fight, to rights to be adhered. That's our lesson from Ukraine. We are fighting not only for our territory, we are fighting for global fundamental values of our existence. Finally, we need to be quick. It's another take from Ukraine. Some of the decisions which earlier took us months and years to take, now we are proceeding in days and even hours. With such report in danger, we cannot be slow, because slowness in decision making also has its measurement. It's lives lost. So it's critical to be quick, because in our fight, we always should remember that we are fighting for people. And this is also our duty and obligation. So together we will win. Thank you.
Thank you so much, Andrew. We've heard highlighted the importance of political leadership. Ms. Anita van den Belt has taken her passionate commitment to equality and rights into politics, into parliament, into government, and is now parliamentary secretary to the Minister of International Development here in Canada. Thank you so much for joining us, Anita. Many of the themes of this report touch closely with what you've been working to do in your political career. Tell us about how, using this report, you can help galvanize international cooperation around equality, around rights, in order to help end the inequalities that perpetuate the AIDS pandemic. Anita.
First, thank you very much for that introduction and addressing those incredibly important issues. I'd like to begin first by acknowledging that I'm coming to you from the traditional and unceded territory of the Algonquin and Anishinaabe peoples. And I'd also like to say I'm incredibly humbled to be on a panel with those who spoke before me and just acknowledge the incredibly vitally important work that all of them are doing. I also, of course, want to thank Winnie, your dedication, your commitment, your tireless passion to inspire people to bring the world together in order to end AIDS as a public health threat everywhere is personally very inspiring to me as well. Comme vous, nous sommes déterminés à nous attaquer aux profondes inégalités systémiques qui sont ancrées dans le tissu même des sociétés du monde entier. We all share a common passion. And as you mentioned, one of the things that drove me into politics was the desire to stand up and champion the rights of women and girls around the world. As the new 2022 Global AIDS Report shows us, an emphasis on women and girls, on intersectionality, on equality, and on the most vulnerable is more important than ever to stopping the spread of HIV/AIDS. Canada is honored to be hosting the International AIDS Conference in Montreal this week and to be welcoming thought leaders, advocates, people living with HIV/AIDS, and global organizations to discuss what more needs to be done to achieve the well-grounded ambitions of the Global AIDS Strategy. Of course, we can't make progress toward the goals of the Global AIDS Strategy if we do not track what's working and what's not. The 2022 Global AIDS Report provides us with timely information and evidence about the setbacks and uneven progress in access to prevention, care, and treatment globally, in large part because of the aftershocks of the COVID-19 pandemic. The report informs us where we need to advocate and invest more. And that, of course, is a message, as you mentioned, to us as political leaders. But it also shows us where there are some very positive examples of progress that others can learn from. I find it particularly shocking and unacceptable that adolescent girls and young women still make up 82% of people newly affected with HIV in sub-Saharan Africa. This is an important area where we need to double down and do more. The report also reinforces the importance of investing in resilient health systems so that when a shock like COVID-19 happens, it does not hold health systems back from delivering the life-saving care, prevention, and treatment. The report highlights some good news and progress made. For example, there's new encouraging results from the rollout of injectable antiretroviral medicines, which seem to have great promise of being transformative if they can be accessed more quickly. Stories of how communities and organizations have overcome obstacles and changed attitudes to address inequalities. Those are the stories that give us all hope. As the 2022 Global AIDS Report clearly states, the global AIDS response is under threat. And that is something that we as political leaders need to respond to. Canada remains firmly committed to ending AIDS using our feminist international assistance policy to guide us. Je peux vous assurer que le Canada, guidé par sa politique d'aide internationale féministe et renforcé par son leadership et ses réponses au VIH-Sida et à la pandémie de COVID-19, demeure fermement engagé à mettre fin au SIDA. I am very much looking forward to seeing all of you. I know that in my pre-politics career, as was mentioned earlier, I worked with many of you, including Winnie, and I'm very much looking forward to being there as part of the high-level Canadian presence, political presence at the conference. Thank you very much. Merci beaucoup.
Thank you, Anita. Merci bien. We have a small amount of time to provide an opportunity for questions. Media who are in the room or who are online can raise a physical or virtual hand or type a question in the chat. If you're watching this online, you can also use the hashtag #InDanger and share your question or comment. And my colleagues will get questions to me. So I will have a look at questions being sent.
There is a hand here.
There's a hand here. Yes, please.
Kerry Cullinan from Health Policy Watch, South Africa. There's been a lot of emphasis on rights and a science-based approach, data-driven. But we seem to see globally a move to conservatism and a move to anti-rights movement. Russia it didn't want to indulge harm reduction in the UN high-level meeting on HIV not so long ago. And recently, over 100 countries wouldn't endorse or vote for the WHO's new HIV strategy because of inclusion of sexual orientation and men who have sex with men. So how do you engage with those countries where we see HIV rates are going up when they are refusing to acknowledge there are such things as key populations in their countries? Thank you.
Thank you so much. Winnie, would you like to answer that?
Sure. You've asked a very important question. It is true that today we're seeing a huge backlash against certain human rights that some were won many years ago. For example, sexual and reproductive health and rights. We are seeing countries that are pushing back against the human rights of LGBTQ people. And we're seeing in fact, sometimes even reinforcement of and further enforcement of punitive laws against people who inject drugs, sex workers, LGBTQ people, and all that. And it is a time when the international community must stand together on human rights. Human rights are an important part of creating the enabling environment for everyone to access what science has to offer. Indeed, UNAIDS, we are involved in many countries in supporting communities at risk of HIV/AIDS, what we call the key populations. These are LGBTQ people, particularly gay men and men who have sex with men, transgender women, sex workers, prisoners, people who inject drugs, in bringing them together and help supporting them to have the voice to defend their human rights. This is a critical part of the HIV response. And indeed, in the multilateral system, we continue to advance international legislation to strengthen those rights. But indeed, it is a battleground today.
Thank you so much. I understand we have colleagues from The Economist and The Lancet. I wanted to give you a chance. Yes, please.
I'm a colleague from The Economist. Thank you. There's clearly been a bad blip in recent years for obvious reasons, but there's a difference between a blip and an inflection point. Do you really see a change in the trend that's going on, or is this just something that's been caused by the emergence of another epidemic, which we are dealing with reasonably effectively? Once people have understood how to integrate that into the health services of countries at risk, we'll be back to the original trend line. Does that make sense?
Yes, it does. Could I ask Dr. Fauci, I don't know if you heard that question. The question was around how concerned should we be? Sure. Please go ahead.
Actually, I'm really very concerned. The reason I say that is that when you have a disease that we have been addressing as a community for now over 40 years, even that alone is a tough sell to keep the enthusiasm up when you're having a chronicity, particularly when you have interventions that are highly effective, even though we don't have a vaccine. We have drugs, we have pre-exposure, post-exposure prophylaxis, long-acting. But the thing that I'm going to be speaking about at the meeting is something that I worry about as much as everybody on the panel, is the implementation of these interventions in an equitable manner throughout the world. There's enough problem of getting that when you have a 40-year-old disease. When you intervene in that, a COVID-19 pandemic, the likes of which we have not seen in over 100 years, now with monkeypox, people are exhausted with epidemics and pandemics. They really are. So I think our challenge is we have to fight twice as hard to get HIV back on the radar screen where it belongs, because it was here before COVID and monkeypox, and it will be here after COVID and monkeypox. So we cannot let down our guard and pull back and say, we've achieved enough of a goal. We're not there yet. And I think that the title that Winnie showed that I have right here, In Danger, I'm really very concerned that it's up to us to push back and put that danger aside. And I hope that that's what we achieve at this meeting. Thank you.
Can I add to that?
Sure.
I agree with you, Tony, and want to add that the good news is that what works, many of the things that work to fight HIV are what you need to fight COVID, to fight future pandemics as well. So what we contribute, what countries, what governments need to understand is that the investment in fighting HIV/AIDS, a big part of it is the same investment that prepares them for a future pandemic and helps them to fight COVID as well.
I want to give we can make time after the event for you to do interviews, but I want to give an opportunity to others. We have a colleague from the Lancet. Would you like to ask a question? Yes, please.
Thank you, Jackie Thornton from the Lancet BMJ. Winnie, you mentioned about the racial inequalities, and you mentioned the UK specifically in the decline being fewer for Black people than for white people. How can high-income governments like the UK challenge these racial inequalities?
Thank you for raising that too. It is the data we begin with, having the data. The data tells us what we produce as UNAIDS every year, and what others complement tells you exactly where within a country the new infections are rising or decreasing, where deaths are. And it is from that then a national response should be built around, targeting the people who are most at risk, delivering services to those who are living with HIV and those who need to prevent themselves from acquiring HIV. I think that the politics is what is important here. Establishing the principle that everyone is equal, should have the same access to services. Once the principle is asserted and you have the data telling you who is not accessing, then we know what to do. We have the tools.
Thank you so much. Yes, please, in the white shirt.
Hi, Jacob Serban from the Canadian Press. We've seen this report and some deeply concerning data in this report earlier today as part of the UN era, as part of the AIDS conference. We heard some really interesting scientific research. And I think it's really interesting, this sort of dichotomy between how the science is continuing to progress, yet at the same time, it can be a challenge to reach people on the ground with these treatments, with sort of the results of this research. How do you see this this dichotomy between these two things?
John, would you like to reflect on that?
I think let me say two things. One, and they all point to how the virus wins when we do not address those parameters. One is the inequality inequality and inequity that we see usually across the board. So even if you have the best interventions on the one hand, and you still have that challenge, which I call the value of debt, to translate those interventions into the right communities. And I would also add in a timely fashion. We've seen how some tools or interventions that are proven to work well against HIV have delayed in reaching the appropriate communities. Secondly is stigmatization and discrimination. You can only make available in an accessible and timely fashion those interventions in the community if the people are available, right? If they are discriminated and when they are discriminated, the virus wins because it goes underground. And even if you have the best tools and products to deliver, you are always challenged. So those are the structural issues that we have to fix to address issues of a timely access to the tools that we currently have. We have, as Winnie said, plenty of tools in our disposition to fight this virus. The question is always, how do we get it into the right communities?
Yeah, I might add to just one small comment to that, John. I totally agree with you on that. And one of the important aspects of the NIH's effort towards ending the epidemic is implementation research. So the new funds that we thankfully have gotten in the coming fiscal year, which has been, only the second year in a row over a period of about 8 or 9 years that we've got increases in the HIV budget, I am devoting a substantial proportion of that to implementation research so that we can get the tools that we've worked so hard through the scientific endeavor, that we can get them equitably distributed in a way that is really applicable to any individual country. So it's more than just the science, it's the implementation. I'm going to be emphasizing that very strongly in my talk on Sunday.
Thank you. And Dr. Adiba?
And if I may add to that, I think there remains many, many countries that have laws and policies that we need to continue to challenge that feed into the stigma and discrimination and put fear into people, particularly key populations, to come forward to access treatment and care, even if it's available.
Thank you. Now we're running out of time. In fact, we've gone over time. I'm going to go to Gus Cairns from AIDS Map, but also there was a nice positive question, easy to answer, from Kalisha Williams at UN News, asking about the Caribbean numbers. The Caribbean numbers are one of the areas of progress. The Caribbean and West Africa were the two regions where we saw notable progress. There continue to be significant challenges in the Caribbean around decriminalization, though there's been some progress, most recently in Antigua, where the courts ruled that anti-gay legislation was against the Constitution. But we see some optimism in the Caribbean. So the last question is from Gus Cairns from AIDS Map. Gus.
Hello, and greetings from the UK. I'm very honoured to be given the last question. It's also a sort of optimistic sort of question, inviting you to be a little more optimistic. I did notice one thing in the report that could be called a triumph, but was rather hidden away. If I read it right, and I might not have been, so please correct me, I noticed that globally, adult women in general have reached the 1990 target, with 74% of women with HIV now virally suppressed, and the 1990 target is 72.9%. It's obviously important to prevent a reversal of these gains, but I think if we celebrate our gains, then we might be more sort of conscious of what we stand to lose. What would you have to say about that?
We should go to Winnie on that. Winnie, you put out a powerful and challenging report about what's wrong, but also what's right.
Well, what's right is that we are part of an iconic movement. The HIV movement is a movement that has made history, that has shaped global health. Today, a poor woman in Uganda, my country, who is HIV positive, is receiving the best tool of science that a rich man in Canada is also receiving. That's the result of the HIV movement fighting for equal access to the best tools of science by everybody in the world, whoever needs it. That's a great achievement. We stand on the shoulders of great people who fought for that. And we can still fight on to make sure that the tools of science reach those who need them most first. That's why we are fighting today that these long-acting tools, long-acting PrEP tools and long-acting antiretrovirals get to young girls and women in Africa who are hiding from parents, from school teachers, from everybody, but are having sex and are acquiring HIV. That's why we want men who sleep with men, who have sex with men, gay men in countries where they are criminalized, to be the first to get long-acting PrEP because they need it first, not because they live in a rich country where it happens to be. So these are struggles that this movement has won before, and we can win again. To me, I'm from the movements. I love being in a movement, and I love a just struggle. And I think this is a just struggle where we can energize each other like we are going to do here at this conference.
Thank you so much, Winnie. Hope is a verb. I'd like to ask Dr. Adiba to close this launch event.
Thank you, Ben. On that note of re-energizing, I think all afternoon we've heard that the AIDS response is in danger. It's at a crossroads. But I think this is why we're coming together for the first time in a few years at the International AIDS Conference, which has this ability to rejuvenate, to inspire, and as the theme says, re-engage. We're bringing you the best in prevention science, the progress in research in HIV cure and vaccine. We don't have those yet, of course, but there'll be plenty of science to show that we are making progress in both those areas, and also the best in implementation science that I think will inspire many other programs and countries of what can be done. This is the unique thing about the AIDS conferences, and I hope that all of you will take the time in the next few days to, like me, needing, like what Tony is saying, that we're all tired, we're all exhausted. But I know by attending AIDS conferences for many years that it does have this unique ability to rejuvenate and be inspired again. So let's hope that we all do that, because we're at a crossroads and we need to get out of this danger.
Thank you.